Psychedelics and psilocybin-assisted therapy been getting a lot of attention over the past few years. I know that you've been involved in some of those trials. Can you just kind of give us a state of the art for psilocybin-assisted psychotherapy for things like depression? What does the totality of the clinical research say today? Would you say it's proven that psilocybin is effective at some level? Where are the clinical trials at in terms of, phase 2, 3, 4, and all of that? So just where are we today with that?
So we are, I would say, at the late stage of all of the research that will need to take place before the FDA will have enough information to decide whether or not it should be made available to the public. That phase of research that we're in is called phase 3, and that's the last phase where a treatment is explored, typically at multiple sites around the country or the world, in hundreds of people, as opposed to these smaller studies that are only done in dozens. Excuse me. And that research is largely pointing towards the likelihood of approval by FDA and probably the European Medicines Agency as well within the next, I would say, 12 to 18 months. So we are pretty close. Of course, nothing scientifically is ever definitive. So I can't say for certain whether that data will lead to approval. But it seems like there's the writing's on the wall to some extent. And the reason I say that is because of not only the preliminary evidence that's being published, over the last few years, but also because, the FDA has signaled to the Biden administration that the likelihood of approval for psychedelic medicines is, strong, and that they're not too far in the future. And so because of that, there's actually been a federal task force that has been initiated at this point to bring together all the different stakeholders at the federal level who would be involved in overseeing this type of dissemination of a treatment. So people at the DEA obviously are involved in this conversation. The people at Department of Health and Human Services who oversee things like Medicaid and Medicare and overall kind of guidance around treatments that should be covered by those nationalized healthcare system. People at the VA. There's a lot of stakeholders involved in these conversations, and my guess is that those conversations would not have been initiated if we weren't at some level of certainty that there's enough evidence already to suggest that psilocybin therapy is going to be at least an effective option for some people.
And what basic results have people seen so far in trials for psilocybin-assisted psychotherapy for depression in terms of, what are the effect sizes? Is it working for a similar percentage to like the 30 to 50% we see for SSRIs? Is it working for more people? Is it working for people who SSRIs didn't help their depression? Like what kind of effects are we seeing?
So it does vary a little bit by study. So I'll try to do my best to summarize. But in general, what we're seeing is that there is a larger proportion of people in these studies who are in complete remission from depression. In our study that we completed at Johns Hopkins, which was the first randomized controlled trial looking at comparing psilocybin therapy to a waitlist, no treatment group, was that 50% of the people that were in that study were in complete remission at 1 month after the treatment was over. Now, keep in mind that, 50%, it's still larger than the 30% in remission, from antidepressants or psychotherapy, but it also only took, 2 doses of psilocybin in conjunction with about 13 hours of therapy. So 1 treatment package, 2 doses of a medication, and 50% of people were in remission. What was really interesting is that at 1 year later, after the treatment was over, that 50% of people were still in remission. So these are folks who often had been on a variety of other medications, had tried psychotherapies, had been through the gamut, so to speak, of other approaches, and either found them to be not as successful as they needed them to be. So maybe they had some benefit, but not completely, or they were dealing with side effects that they didn't like, or for some, the treatments never helped. So that's pretty remarkable in and of itself, just to kind of see that on some of the other larger studies that have been conducted now, comparing both to placebo as well as other treatments like SSRIs, we see that in one of those studies there was on almost all all indications of looking at the variety of ways you can measure depression. On almost all of them, they showed that psilocybin therapy had a favorable treatment profile compared to SSRIs, with the exception of this one measure that was kind of their official measure of symptoms, which subsequently now there's been some interesting studies looking at whether that measure was actually appropriate to use as that comparison. And yeah, but in any event, the reason I bring that up is because there's likely to be some diminishing effect as we get into these bigger studies, as we compare to placebo, as we have hundreds, if not thousands of people that are eventually treated in these studies. I think we're going to see that it's maybe not as high as 50% remission, in part just because, those studies that are so small, they're so selective to get into them. It's very narrow in terms of the type of people that are in those kinds of studies. And so, similar to how we have people who don't have just like a purely biological basis of depression, right? And we kind of, as you disseminate treatments out into the real world to real people who are not so selectively, chosen, we're likely to see some diminishing in that. It's likely though that it's still at least as effective as other options, if not probably more effective than other options.
Yeah, and I imagine that's typical, right? As you progress with the phase 1, 2, 3 trials, they get bigger and you're casting a wider net, and that's probably common, right? That the sort of effect size is probably diminished somewhat as you go through that progression.
Absolutely. So it's definitely expected with every treatment as it reaches a broader and broader sample of people that have been tested, and again, even when it goes from testing to implementation, you're certainly going to see some diminishment of effect there as well as it gets to like the biggest potential population. At the same time, even if we end up in a place where we can say statistically or scientifically that it's the same effectiveness as other treatments, it still only takes 2 doses of the substance. It has a much more favorable side effect profile. It leads to other really important things that people talk about in terms of their identity development and understanding their relationships better, moving towards things that are important to them in their life. So even outside of symptom reduction, this treatment provides a whole range of other types of enduring effects that people find desirable and important. And I think that that's very unique to this type of treatment. So even if it's only as effective as other treatments, it still seems like for some people it might be a much better option.
Yeah, I mean, it is remarkable that you see this kind of effect from just 2 doses of something in the context of several weeks of psychotherapy. So for the trials that have been done or that you've been involved with, are the people that are willing and able to do the psilocybin-assisted psychotherapy, are these typically people that have tried other things and it hasn't worked, so they're just really hoping that something new will work? Or like, and sort of the other thing that's related to that, I guess, is how many of these people are completely naive to psychedelics and have never tried them before? How many of them had previous experience with psychedelics? And what's your sense for what chunk of the patient population is going to be excited to try something like this if other things have failed, and what percentage might be intimidated and wouldn't want to go through something like this?
So most of the studies that have been completed specifically with folks that are considered treatment resistant, which means that they've tried at least 1, sometimes 2 or more other treatments, and the treatments have not been successful. That's not the case for every study. Like our depression study at Hopkins, we didn't require that they had that background. But I think because of the nature of these studies right now, the nature of them being highly experimental, they're using a psychedelic, which has a whole, stigmatized background in people's minds about what psychedelics are. Because of all of that, we're still typically seeing, even when it's not a requirement, that most people in the studies have had several medication trials in the past. It has not worked for them. And so they find their way into these studies as kind of like a last hope, of trying to find something that will work for them. But in terms of the kind of the folks that this, I'm sorry, I'm kind of losing track a little bit on what the second part or third part of your question was. Maybe you could repeat it if you'd like.
Oh, yeah. I was just asking, are there differences between people who have previous experience with psychedelics versus those that don't? And, what's your general sense of, what percentage of people say are going to be interested in trying something like this versus those that, might be intimidated by the nature of a psychedelic assisted psychotherapy?
So most of the studies have a requirement that people have to have limited exposures to psychedelics prior to coming in the study. Usually what that means is that no exposure to psychedelics in the last 5 years, and there's a preference for really none ever, ideally. But if it's more than 5 years ago and it, was kind of like more like a recreational experience, it wasn't really done for the intention of a therapeutic experience, or even if it was, but it didn't lead to like any kind of measurable important changes or something like that, then people can get into the studies. But it really is trying to minimize, knowing that this is potentially the first time someone has been exposed to a psychedelic.
So in general, it sounds like the majority of patients that have gone through the trials that have been done so far are often treatment resistant. So they've tried other things, at least one other thing before, and the majority of them are also have limited to no history with psychedelics.
Typically, that's probably a typical profile. Or if they have had experience with psychedelics, it's been, in their, years, if not decades ago. It was kind of like a blip of experimentation or something like that. But it wasn't like they were continuing to use psychedelics into adulthood or things like that. So typically that's, I would say, a pretty common profile in the studies. However, there are some folks who, especially on the history of depression side, there are some folks who have not tried treatments before, especially in our study at Hopkins, as I mentioned, that we had several people in that study who had not tried anything in terms of treatments before that. So it's not the entire, encapsulation of folks, but that's a good general swath. So I think in terms of like the latter part of your question about, are there going to be people who are afraid of this treatment or who are going to have thoughts about it? I mean, absolutely. I mean, people have thoughts about it now for sure. There's people who, are out there who I'm sure have, for the last, 4 or 5 decades been, living in a misinformation campaign about psychedelics, from all levels of government and education spaces. So, that unfortunately that misinformation campaign has done a lot of damage to helping people understand what these substances are, their history, their long term, in most cases, history of use in indigenous communities for things like treatment and rites of passage and at different parts of the developmental trajectory in people's lives, that these medicines have been used, far longer than the Western research has been going on. So, but that information and that understanding and that contextualization and really the absence of any cultural container or context in the US for psychedelics as a result of that has led to people being afraid of these substances and people worrying about the potential risks that might be involved. There's been just like fabricated lies told to them for so long that, you just start to believe the lies after a period of time.
And, in terms of the subjective experience, when people go through these therapy sessions that are assisted with psilocybin, obviously everyone's going to have their own unique experience, and no two experiences are going to be identical or even similar. But, in terms of the people that go into complete remission, 6 to 12 months out, and those that don't really see response, are there any kind of common threads in terms of how they report their experiences being? Do people who go into remission like report a better, less terrifying experience or a stronger experience? Are there any patterns there?
So there are some patterns that have emerged. I mean, we know that some of the acute effects of psychedelics, things like the insight component, getting a new understanding, a new realization or awareness of something about yourself, about things that you've struggled with, about relationships or things in your life that are difficult, that those insights, that those new understandings can be incredibly powerful, and are often correlated pretty strongly with mental health improvements. The mystical or spiritual experience is another acute effect that there's evidence to suggest that these spiritual moments in the psychedelic experience can also be helpful. They can be impactful. For some, it's described as, one of the single most or top 5 spiritually significant and psychologically insightful experience of their entire life. And so the impact of that type of experience can certainly not only mathematically or statistically be related to outcome, but I think it's just in general related to why people's perspectives have shifted and changed in terms of how they view themselves, how they view the world around them, and also, how their mental health shifts and changes as a result. But there's also, a variety of biological things that are happening in the brain. We know that for people who are depressed, the part of the brain that is kind of interacts with that depression that will like overreact when it sees negative emotional things in the environment, that will kind of reinforce this like depressive state, this depressive kind of attitude, because it's lighting up when it sees, someone frowning on one side of the street as opposed to like someone smiling on the other side. Like it's taking that information, and the brain is like it's substantiating their depression, right? Like, oh yeah, like it is, life does suck because look, this person's unhappy, right? That part of the brain, when you have exposure to psilocybin therapy, that part of the brain reacts differently after the therapy is completed. It does not respond as strongly to that negative emotional information in the environment. And so, just the fact that the brain is changing in how it responds to things going on around the individual, helps us to see that it's not just someone's, trip, although the trip seems to be important and helpful for people. But it also seems to be there's just like biological changes happening at the level of the neuron and the synapse in the brain that might also be contributing to this benefit. So, and there's a lot more that, we're just starting to better understand. There's experiences of difficult physiological experiences that people sometimes feel as like a release of some kind, an energetic release of some kind. Some people talk about emotional catharsis and ego dissolution and a variety of other things that we're really just starting to tap into to better understand how it's related. But any of these types of things, any of these types of experiences seem to be potentially helpful for people.
In terms of the enduring effects. So you mentioned that in some of these studies, they followed up with patients 6 to 12 months after they did psilocybin-assisted psychotherapy, and a significant proportion of them were still in remission, which is great news. What's the longest anyone's ever looked out? Is it 12 months or is it even longer?
My understanding is that the study that we did at Hopkins with a 12-month follow-up is the longest that's been published so far on folks with depression. I do believe that there are some studies that are trying to look beyond that now. We're actually at Hopkins, we're trying to do a 4-year follow-up of all of those people who participated in that study, just to see it, at 3 to 4 years out, how does it look now, this far out. So we'll kind of know, hopefully by the end of this year or early next year, what the results are from that. But as far as I know, that 12 months is the farthest out that studies have published on the topic of how enduring those effects have been. And in that study, we found that, still about half were in remission. And we also found, even at 12 months out, that people were reporting that, that experience was still one of the most personally meaningful, experiences of their life. And so I think that, it led to a lot of other things besides just, for some, an antidepressant effect. For some, it also led to new meaning and purpose.
And so what are there any enduring or lasting side effects? Do people report any type of physiological change or anything else that outlasts the treatment itself?
So some of the most common side effects are things like transient anxiety that can happen especially during the onset phase of the psychedelic experience. For some people, that can be really difficult. There can be panic, there can be fear and anxiety. It's one of the reasons why we do so much therapy ahead of time and why there's trained professionals in the room with someone when we do this treatment, is to help manage some of that. One of the other really common side effects is headache that comes usually later in the day of the session, sometimes over the following night or evening. But outside of that, there are very few, and as far as I can tell, no serious side effects for people. Now, that's also taking into consideration, a very careful selection process into these studies. And so when you look at just people using psychedelics out in the real world outside of therapeutic context, there is a small but still, meaningful risk for, enduring problems related to, people have probably heard of like people having a bad trip. People have probably heard that there are people who struggle with, some of the psychedelic effects that come back even after they've come down from the trip. And sometimes those lingering effects, like still seeing things moving in the visual field, or still feeling kind of unsettled, or kind of feeling some of the things they felt during, that panic or fear place of the psychedelic state. Sometimes for those people, there are some people who develop what's called HPPD, which is this kind of long-term, ongoing, kind of continued experience of these kind of negative psychedelic effects. It's a really rare condition. It's estimated it's less than 1% of people who have developed this type of complication. And so far that has not happened at all. It's been 0% in the clinical trials, but in part because we're screening people out who might potentially be at risk for that. So people who have like a history of, psychosis in their family, who have, potentially like a predisposition to having some of those challenges, are weeded out of the studies. So, overall, there's, I think, very few, risks involved in actually, if you're carefully screened, if you're carefully prepared, if you're working with trained professionals, but there are risks that are there, and some of the risks that are there, even when we do such careful selection and screening, are there's risk to kind of being vulnerable to suggestions, of being vulnerable in a psychedelic state to things that people might not otherwise consent to. So there's been some studies that there's been some question about what kind of therapy was provided, whether or not the providers of those therapies were acting in ethical ways in terms of things like touch during a session, or kind of how they engaged physically with an individual. And there's even been some cases reported, in some studies, of sexual abuse. And so there are absolutely, and I'm not just talking about psilocybin, I'm talking about just like psychedelic therapy, generally speaking right now. There are risks involved with people being in a vulnerable state that don't necessarily have anything to do with the side effects of the medication, but just have to do with like being in this kind of really intensely vulnerable space with other people.
And in terms of the psychotherapy side of psilocybin-assisted psychotherapy, there's several weeks of therapy that are surrounding the usually 2 doses of psilocybin that people get. Is this a new form of therapy that's very specific to these studies, or is it basically one of the standard forms of therapy like CBT or something? What does the actual talk therapy side of this look like?
So the therapy that's provided is in some ways kind of unique, because part of the therapy is preparing someone for a psychedelic experience. So, that certainly is something unique to this type of approach. And we spend many hours with people talking through kind of all the different types of things that might happen during the psychedelic experience, and also helping to prepare them with skills, things they can use and do to navigate that psychedelic space. So that is obviously unique to this approach. But there's other things that we're doing as well that are not unique to this approach. Connecting with people in the therapy also means, talking about things like their emotions and their behaviors and their thoughts, and talking about things like mindfulness and things that, as I mentioned earlier, are kind of featured in a variety of different therapeutic approaches. So for some studies, they're actually tying together the components that are specific to psilocybin therapy and, measurable components of official other therapies. So there are some studies that are using a acceptance and commitment therapy approach, and there's some studies who are using motivational interviewing or cognitive behavioral therapy, and they're really doing a full therapeutic package that you would otherwise see kind of in a study just of that therapy. And they're kind of tying that, embedding that within, this other kind of psychoeducational component for preparing people for psychedelic experiences. And there's a lot of studies that aren't, tying a specific therapy, that they're kind of maybe doing a little bit more of an eclectic or integrative approach. But I would say that most studies are using some, mix of both kind of what we already know is helpful from other therapies and kind of tying that into this newer approach for psychedelics.
And I mean, there's a lot of different psychedelics and other psychoactives being investigated for all sorts of different stuff now: depression, addiction, other things. I know that you've done some work sort of comparing and contrasting some of these drugs. So I know that you've looked at psilocybin versus things like 5-MeO DMT. And so what have you seen there so far in terms of what are the major differences there, both in terms of subjective effects, the length or duration of the effects, and what do we think might be relevant there in terms of, therapeutic potential?
So, there are a variety of differences with psychedelics. They're broadly classified in the same group, but they can be very different depending on the context that people are in and the type of substance they've consumed. For comparing something like 5-MeO DMT to psilocybin, one of the biggest differences is the duration of effect. So 5-MeO DMT typically lasts somewhere on the average of like 20 to 40 minutes, depending on the how it's consumed or how it's put into the body. When it's smoked or inhaled, it's much shorter duration. When it's injected intramuscularly or kind of evaluated in a slower way into the body, the effects are longer, but it's still, less than, 45 minutes, compared to psilocybin, which is, 4 to 6 hours. And that's compared to something like LSD that's, 10 to 12 hours. So, there are obviously a variety of the ways in which the duration of these effects can be different. And because of that duration and the way in which things, there's the time course that people have in these experiences, there's also differences in the way that the kind of effects will fluctuate, that people might have a variety of different types of experiences with psilocybin that kind of ebb and flow, as the substance is moving its way through the body. But with 5-MeO DMT, there's just such a narrow window of time to have any experience that it often just like comes on. There's like one experience and then it kind of comes down, as opposed to psilocybin where it might come in waves. There might be like an overall wave of effect that kind of reaches a peak and subsides, but there might be like kind of additional waves that kind of come and go, especially throughout the latter hours of the experience. In terms of the differences in the acute effects, I mean, those vary so much just even within substance by everything that relates to the individual who's consumed it and the environment that they're in and the preparation that they've had and their cultural contextualization. So there's so much just inter-drug differences. So it's hard to compare them directly in terms of the subjective effects. Although one of the biggest differences with something like 5-MeO DMT is that it doesn't seem to have as much visual phenomenology as other psychedelics. So it seems to be potentially more emotional and psychologically psychedelic as opposed to visually, but seems to have equal, if not greater, intensity of reported effects in other ways in terms of the emotional catharsis that people report experiencing, or these really deep, mystical and spiritual or insightful experiences that people report. So yeah, there's some overlapping things across these substances, but also a lot of, just a lot of differences.
And so based on your experience with some of these trials and everything that you've done, there's a big question, in the field of psychedelic science, generally speaking, around, whether or not the subjective effects are therapeutically relevant or even, potentially unnecessary, or whether they're just, basically a side effect. And there might be an ability to create derivatives of existing psychedelics that have the benefits around, generating the clinical outcomes we want, but that don't require tripping at all, or at least less than something like psilocybin or DMT or whatever. Based on your clinical experience on the clinical side here, do you think it's likely that such drugs will be created? Do you think that the subjective effects are likely involved in the therapeutic outcomes here, or are they plausibly irrelevant?
As someone who's provided this treatment to people and seen firsthand the importance and the relevance of those subjective effects, it's hard for me to imagine that stripping those away would otherwise still make it effective. At the same time, as a scientist, I wouldn't rule it out. I just know that I haven't seen that work yet. So it'll be curious to see with some of those studies, whether or not they're able to demonstrate that it can be as effective. I still think that people should have the if nothing else, have the option and the opportunity to choose the fit that's the best fit for them. It might be the case that maybe for those people who aren't in remission, from the typical psychedelic therapy approach, perhaps those people, maybe the acute effects were distracting, or, otherwise were confusing and led to, difficulty in integrating the experience. We've had some people who could make no sense of what happened to them in the psychedelic experience, and it was kind of distressing and difficult. And so, for those people, maybe a better fit would be to then try a psychedelic without, the acute effects, and to see if that was helpful for them. But for others, there's such important meaning making that comes from these acute experiences that, I would hate to see that stripped away from the model completely. So hopefully it's a both and situation in the future. There's going to be some people who are just terrified of psychedelics and the experiences that they've heard people have. And for those people, it might be better that they have an option that still potentially brings them relief, but obviates some of that anxiety. So yeah, I hope to see a place for both approaches. But my current experience seeing people, with these experiences is that to remove that completely would be missing the point